Well, I think, or just to give you an example, to make it easier for people to understand what I'm trying to say, let's talk about sciatica for a moment. And the WHO guideline initially is meant to cover, the evidence base for all chronic back pain, and including spine-related leg pain, or what we normally call sciatica. But the guideline has a caveat in there saying that they couldn't really assess the evidence for specific groups of people with chronic back pain, such as spine-related leg pain like sciatica, because there's, it's a complete mess in the field. People use different definitions to define sciatica. The studies themselves are not really good. But just to talk about pain medicine specifically, there's a huge problem with the body of evidence for sciatica specifically. So if you look at the number of trials of pain medicines for those conditions, we've got one trial of opioids with 25 people. We've got 3 trials of this antidepressant that's very commonly used for neuropathic-like pain conditions, like amitriptyline, for instance. So there's 2 trials testing this medicine, and the combined sample size is 77 people in 2 very small, poor quality trials. There's another antidepressant, which we can talk about a bit later, called Duloxetine, which is a serotonin norepinephrine reuptake inhibitor. That's been tested in 1 trial with 25 people. There's 3 trials of pregabalin, 2 very good trials and 1 not so good. And then 11 trials of anti-inflammatories or of NSAIDs. So I guess except for NSAIDs, there's just not much out there. The evidence is just not there. So while I do understand, again, that guidelines have to make a recommendation, it's not good practice for guidelines to say, there's no evidence, I will not recommend this, I will not make a recommendation. I think this is a very good example of a subgroup of people with chronic back pain, at least, for which there isn't evidence at all, or reliable evidence to guide a clinical decision.